Hi, guys. Welcome to another episode of Secrets of the Scalpel Beverly Hills Plastic Surgery Exposed. I'm your host, Dr. Ariel Ourian. We have a very, very special guest today, Dr. Dubinskaya, and she is a sexual health expert, pelvic floor reconstruction. She's going to tell us more of what she does. So let's talk about sex today. Again, this is for educational purposes only. Hello and welcome.
Hi, thank you for having me.
Of course. So before we jump in, tell us a little bit about yourself, introduce yourself, and kind of what you do.
Of course. So, Alexandra Dubinskaya. I'm a urogynecologist and pelvic reconstructive surgeon. My special interests also include sexual function, predominantly female sexual function, and menopause. I have an office in Beverly Hills. I'm affiliated with Cedars-Sinai, where I do my surgeries.
Nice. And very complex surgeon, and we come kind of share patients once in a while. We'll kind of get into all that stuff.
Absolutely.
First, let's share how we met. We met under very interesting circumstances.
Yes, it was a hot summer of 2023. The reason why I remember, because I was very
You
pregnant.
were very pregnant.
Like, yes, I was still wearing high heels. I'm Russian,
I
so
remember.
we're wearing high heels no matter what. I was about to have a C-section in a couple of days, but that was an orgasm day, and we had a workshop.
National Orgasm Day.
Exactly. So I was giving presentation, and you was talking about mommy makeover. So that's how we met.
That is how we met. National Orgasm Day.
Yep.
So you had your baby the next day, or
A couple of days
a
after,
couple of
yeah.
days after?
Yeah.
Very cool. So let's talk. Let's jump into it. Let's talk about sex. Let's talk about some of the sexual health things that women. What are their concerns? What do they come to you? What do they want to know? What are their problems that they're trying to address?
Yeah, they come with all sort of questions because there's so many like unknown, so much unknown in the sex topic, especially when it's about women. It always has been this notion of like, oh, do you have a pain with sex? You do. Drink some wine or relax. And that
Wine is
was
good, but it may not help your problem.
exactly, yes. But that's it. That's the only thing that women would hear. So now I think slowly, slowly, this field start developing, and we know more. We know that there is more just being relaxed or have a glass of wine. There is the whole approach has to be like biopsychosocial approach. We think about emotional component, mental component, physical component, and it's all very important for women. So whenever somebody comes in and says, I have a low sex drive, it's not just about, or have this scream cream or have this Viagra or something. It's actually evaluating women as a whole. Is like, what's going on? Is she just had a baby and she's sleep deprived? Of course, nobody want to have sex when they sleep deprived. Or is there something hormonal going on? Or was she brought up with a very strict cultural upbringing, religious upbringing, that not letting her just enjoy sexual activity? And then, if there is anything physical going on, examining the woman, looking at her clitoris, at her labia, at the vaginal dryness. Is she going through menopause? So, all of that is very important, and checking the hormones and reflecting on everything. So, it takes time, and it it's I'm sorry, I'm going on a tangent. So it's very complex, and I love exploring it and kind of like teasing it one by one and figuring out what I can, like, how can I help the woman.
Right. I feel like it's almost taboo to talk about it, but it's fine. There are experts like yourself who can help these ladies achieve sexual pleasure, orgasm, and figure out why they have the low sex drive. So these are things that really can be addressed. There's an expert that can help you, and it's really important. Sexual health is something that's not talked about,
Yeah.
but it's really important.
And if you think about like what's the main categories, right? Like kind of you can put each problem in is the issue with arousal, issue with desire, and orgasm or pain. So that's kind of like a four main categories that I see women come in with. Some people have an issue with wanting sex, right? Like low desire, low libido. And it's very important to explain to women that, For men, it's very common to have spontaneous desire. I see the object of my interest and I go.
Yeah, it's
And
very
for
different. Men and
yes,
women are very different in
well,
this
for
regard.
women, they also can have that, but it's more common to have responsive desire. Kind of like I was not in the mood, but as we started, great, we did that. So, in terms of arousal, the whole body participating in arousal. So you do have to be in a very good physical shape in order to generate that arousal, like the whole body response, genital response, and mental response. In orgasm, there's a lot of things involved.
Yeah, I mean, most, I don't know the exact statistics or numbers, but women do not necessarily orgasm every time they have intercourse.
Absolutely, and there is definitely orgasm gap. Men in heterosexual relationship orgasm more frequently than women in heterosexual relationship.
Right. And that's also something that's not talked about. Women may feel uncomfortable talking about it and things like that.
But you know what's interesting? There are studies that was done, and actually, it takes women less time to orgasm on their own than with men.
Really?
Yep.
Leading into that, we have some toys here today that we want to talk about. I know you talk a lot about here's some toys. You can kind of
Okay.
show us, well, not show us, but kind of talk about toys and in terms of using vibrators and things like that, that women should not feel ashamed or anything like that. Tell us a little bit about toys and using toys.
Absolutely. You know, I really like to call them devices.
I apologize.
'Cause-
Devices.
No worries, but it kind of removes that stigma because culturally, historically, it's kind of like, oh, a toys, it's about like pornography. But it's actually an amazing device that helps stimulate the area and bring more blood flow. So it actually improve pelvic floor condition, helps with sexual function. And believe it or not, we actually did a study at Cedars, a prospective study where we were giving vibrators to women.
Free vibrators. Just like
Exactly.
free condoms, free vibrators.
So we were giving them vibrators and we instructing them to use it like 2-3 times a week for 10-15 minutes, and they were using it outside. And we assessed the pelvic floor function. We asked them a lot of questions. They completed the validated questionnaires. And then they came back in 3 months and we did the same evaluation again. And what we found, using vibrator on a regular basis helps to improve the symptoms of pelvic organ prolapse, urinary incontinence. It also improves vaginal dryness and some skin condition like lichen sclerosis. It also helps with sexual activity, helps experience multiple orgasms, and actually improvement in mental health as well. So now having the data helps a lot. I mean, obviously we have a lot research to do, but it helps a lot to break that stigma and tell women, hey, there is actually a scientific basis for it, and you should not be ashamed, and you can use it same way as you're using like the Theragun for your back. And there is exactly the same muscles, and there is exactly the same issues happening down there. So you do need to keep the blood flow going, and the vibrators is the excellent way of doing it.
And you know, do you recommend one vibrator over another? Which vibrators were we giving at Cedars? Did it have?
Yeah, well, you know, at that time, nobody really knew me. So I was calling each vibrator company and asking, can you please give me some vibrators so I can do the
Can you
study?
give me a shipment of vibrators,
Exactly. And I was like this young fellow with a lot of time in my hands, and I was very passionate about it. I had amazing mentors who were supporting me. So it was a simple bullet vibrator. One of the companies, I really appreciative of that company, donated the vibrators. Once the study was completed, there was multiple companies were reaching out, offering their vibrators to do research. So now actually that study is quoted in some of the inserts for the devices, for the vibrators, yes. So when women ask me like, okay, how should I start? I never used the vibrator, what should I do? I think it's very important to know what medical condition women might have, because for some reason, there is this notion that the bigger vibrator, the better. But not too many women actually insert vibrator in their vagina. They predominantly use it externally. So there is a great vibrators that you can use externally that very quiet, and there is a different settings, which is also interesting. And we're doing that research now to figure out which settings women prefer, which is interesting. So
This is getting very scientific and data driven. I love it.
exactly. So, and one of the problems that I'm noticing vibrator having, it's buttons. If you look at any vibrator now,
Oh, look
it's
at this
kind
one
of
here.
it's about the buttons, and it's actually not that easy to operate that, especially if the women are older and they have some issues with their dexterity, like issue with arthritis. It's quite difficult to figure it out. So if the woman is older, have some issues with hands, I usually recommend vibrators that has more pronounced, like defined buttons.
Yeah, this one, the button is actually not very pronounced, and it's actually kind of,
Yeah, and it's very difficult to figure out how you can increase the intensity, change the settings, or if you change the setting, how can you go back to your original setting? So it can be very frustrating. So that's very important part. Also, the material that the device is made of. Some of the materials can pull the skin and make it very uncomfortable. There is different motors that the companies use. Some of them, if you turn them on and you hold the device in your hand, you can feel how hand goes numb. So it's not really good.
that's how my hand goes numb with doing liposuction. Power assisted. No, seriously.
Because there's also, yeah,
Vibration can cause issues with nerves.
exactly. So in some vibration, it's actually feels pleasant and feels good, and you don't feel like your hand going numb. I usually keep some vibrators in my clinic to show to my patients, like, okay, this is the option. You can hold it, you can touch it. Quite often, I order vibrator together with my patient because they don't know where to go, how to order it. And another issue, people sometimes are very scared that it's going to arrive in a see-through package and all the neighbors will know. So it's usually not the case.
So we can share a funny story of how these vibrators got to this office. So for this podcast we were preparing, and we realized we didn't have vibrators to show our listeners. So I went on to Postmates,
Shout out to Postmates.
yeah, and searched, and CVS on Wilshire and Doheny had these in stock. They didn't have the exact one in stock that I ordered. So the driver called me. He said, "Can you order some other ones?" And this is what he found. And it came, even from from a Postmates delivery, it was in a sealed bag, and there was no stigma. It's okay.
Yeah, but I really like how the driver actually called you.
He did.
And clarified. I think it shows the real progress.
Yeah, he actually took a picture of all the devices that were on the shelf there, and we said, I told him this is for a podcast. Circled a couple ones, and he got it. And it's just nice to have a demonstration.
Did he say
here.
like, "Oh yeah, for podcast"? Yeah. They all say that.
So yeah, I'm happy we talked about this. Kind of talk about getting rid of that stigma. Let's talk a little bit about pain during intercourse.
Yeah.
This is something that we see both in both of our practices. I see patients who come to me, my labia is really long, and I have pain with intercourse. So what are your thoughts on elongated labias and things like that, aside from the aesthetics, which we'll get to,
Yeah.
but in terms of function and long labias?
For some reason, it has been such a controversial topic, maybe not controversial in the world of plastic surgery, but in gynecology, such a controversial topic. And there is always this notion that you has to tell women that she's normal, that there is nothing wrong with your labia, because we don't really have any tools or any measurements to do to say
what does a normal labia look like? There are different shapes.
Exactly.
Right.
Yeah.
And it's the aesthetics of what a woman likes, and also obviously her pain. So there's two things that go hand in hand.
But initially, let's say if you're evaluating the patient, right, and she says, "You know what, I'm not happy with my labia." So the way how I was taught, and I always, it would be so upsetting and go against what I believe, to say, "Oh, it actually looks normal. It's functional. It's good." So which kind of invalidates how we feel. And then there is second belief that the women who wants to have labiaplasty, they just watch too much porn, which is also kind of, I know my height. I can compare my height to other people's height. But how can I compare my labia to labia of other people? I mean, due to what I do for a living, I see hundreds and hundreds of them. But for the person who's not doing what I do for a living, it's kind of very difficult. So where else you would go? For like porn websites is actually one of the largest libraries of the
Right.
genital appearance. So and obviously and actually we did another study getting scientific. I was very proud of myself. I made my department watch porn for the research project.
No, I'm kidding.
So what we did, we said, okay, so if we tell that women learn about labia appearance from pornography, let's go on the website and watch the most watched videos and see how the labia looks. And actually, yes, predominantly looks very I don't want to say put together, but basically labia minora is smaller than labia majora, but there was a pretty significant variation. And if you go, if you search for terms like dangling labia or something like that, you will find plenty of videos with that appearance. So pornography has variety of organs. And we did find that majority of labia looks like post-labiaplasty appearance. But it also desire for aesthetics. Same as with breast on nose. Everyone wants to have some beautification done for their body and nothing wrong with that. Would that improve their pain if they have a pain? It might be if the pain is due to the large labia, but if the pain due to their
other issues that can
exactly
cause their
vaginal
pain.
dryness, fibroids, no, it won't.
So when I get patients who want a labiaplasty and share that they have pain, I always ask them, have you shown this to your gynecologist? So that's one of my requisites is you need to see a gynecologist before we have surgery. And let's kind of talk more about a labiaplasty. So just for anatomy's sake, we have a labia majora and then we have a labia minora. Okay. The labia minora is really the area that we're talking about that people want to make a little bit shorter and more tucked in.
Yeah.
And in my practice, we're able to do that even awake in the office. And sometimes patients actually do bring me inspo pics from pornography. They say, I want my labia to look like this. And most of them have just a very tucked in appearance, neat. And that can be done, again, awake in the office. And the shape, we try to make the two labia more symmetric. No two labia are symmetric. That's another thing that patients need to understand. No two labia are twins. We have sisters. So that's a labiaplasty of the labia minora, which can help with aesthetics and in theory with pain if that's the issue you're having.
You know, it's interestingly, just recently I had a patient who came in for me for second opinion, so multiple GYNs, has a severe pain in her, as she said, vulva. And I'm like, okay, what treatment are you getting? And she said, I'm getting lidocaine. I'm like, okay, but what treatments are you getting? Because lidocaine is not a treatment, it's just a patch.
Putting a Band-Aid on the problem.
Exactly. So I'm doing an exam, and the first thing I see is the very prominent labia. And it's very like you can see that it's been rubbing on a clothes and everything. And I just asked her, I'm like, do you think your pain related to your labia, that it's a little bit bigger? And she said, that's exactly what I think, but all the gynecologists told me that it's normal.
Kind of going on the dogma of being their training is that it's normal, it's a normal variant.
And I felt so bad, and I did the full evaluation and everything, and that was actually the only area that bothered her. So when we numbed that area to pretend that we removed it surgically, right, without removing it surgically, her pain went away. So, and I respect my colleagues, but sometimes when you see it, what's reasonable sometimes actually is the problem.
Right. So that's the labia minora, and it's really functional and cosmetic.
Do you get a lot of patients after they have a babies, after some changes happen? So do you have more patients who's younger?
I have both actually, and let's talk about the older ladies. They often want a labiaplasty of the labia majora. So I can do fat grafting to make it more rejuvenated, more plump.
Yeah.
So that's done through fat grafting. And then if they want some modification of the labia minora, we can do that at the same time. in regards to younger ladies, it's usually just the labia minora that they want, either again for aesthetic reasons, for functional reasons, or for both. As an added procedure I do for older ladies is a vaginoplasty, which is different than a labiaplasty, where the canal, the vaginal canal, I can make tighter for more sexual pleasure. And you know this anatomy obviously as well. So the posterior wall, a layer of mucosa is taken off. The muscles are sewn back together to create a nice tight vaginal canal. So this whole term of vaginal rejuvenation can get very confusing.
Exactly.
Again, there's labia, and then there's vagina, vaginoplasty for the vaginal canal, labiaplasty for the labia majora and minora. So, but yeah, I have patients who come in with insulo pics from pornography, and I try my best to get them to their goal.
But same as you would go to your hairdresser and say, like, okay, this is what I want.
Except you're not going on porn and taking screenshots to go to your hairdresser. But, the goal of, this podcast is to expose things. It's uncensored. We want patients to feel comfortable talking about this. And so a lot of times when patients come to me and they ask about this, they're a little bit embarrassed. And we just want to kind of support those patients, saying, no, you don't have to be embarrassed. There's nothing wrong with what you're asking for. You can come. It's fine. We can help you. There are treatments available.
Exactly.
So one of the other things I wanted to talk about, so we'll cut that part out. One of the other things I want to talk about is sexual pleasure. Does, anecdotally from what my patients tell me, they have better sexual pleasure after labiaplasty because sometimes, especially when the clitoris is covered by the clitoral hood, you can expose the clitoris just a little bit more, so it's easier to have orgasms and sexual pleasure. What are your thoughts on that from the gynecology perspective?
So it's a tricky part.
It's tricky. The clitoral hood and the clitoris is a tricky part surgically.
Well, this is also another tricky part, is being a woman is tricky part. Because you know that any treatment in sexual medicine needs to be compared to placebo. And if you just introduce placebo for the treatment, it has 60% success rate, placebo. So sometimes, same way how like you got a new haircut and you feel so fabulous and you like ready to conquer the world, I think there is also can be part of of that when you feel confident in your body.
Right, that's a huge thing.
So, and you open for like new, don't want to say opportunities, but
we get a lot, I see a lot of patients, they have new opportunities, and confidence is huge. Feeling good
like
about
body
yourself.
image. If you don't feel good in your own body, like you kind of like, you project it on all your life. So you do want to look good.
I couldn't agree with you more. This is kind of like my life is making people feel confident in their own bodies. And obviously this is a part of people's bodies. And if that extra confidence can change their lives and have more sexual pleasure and have these added bonuses, I think it's, I really live for this, and I love seeing my patients happy and confident. You can really change someone's mood, someone's just entire appearance just by having
Touch
these
of
little...
Botox.
Yeah. Natural Botox.
Goes a long way.
So, it's functional. It's changes the way you feel about your body, the way you feel about yourself, and how you project yourself to others.
Yeah.
So that is a great point. So I see younger ladies, I see mommies who've had their kids and want a mommy makeover, and I see these ladies who are a little bit older and want more mature, more experience in life. And then what I offer them is called the menopause makeover, where we're doing things that are different. A mommy makeover focuses on the breasts and the tummy tuck. Menopause makeover focuses more on facial rejuvenation, eyelid rejuvenation. We can certainly do breast rejuvenation and anything else, but it really focuses more on facial rejuvenation. So let's talk about menopause, hot flashes. How do women deal with this? What are the latest recommendations? What should women know about this? Hormone replacement. I know this is a loaded topic, but give us the skinny on menopause and treating menopause.
Absolutely. When I think like menopause becoming like a more popular topic, which I'm like really grateful about, because the way how I even got in that field is majority of my women who I see as a urogynecologist, they like after 40 predominantly, and they start going through perimenopause, menopause, and they dealing with all the symptoms. And yes, I fix the pelvic floor, but it's also important for me to see like the whole person. And they're not going to feel better if they still like dying from menopause, can't remember what's happening, and can't find the words even though they stop peeing themselves. So I start prescribing them hormone replacement and learn more about the field. So now I can help women with that, with those issues as well. So there is, let me stop going on attention. Hold on. Um, I think very important to realize that hormone replacement is not unnatural. It's actually the most natural thing you can do because you have been having those hormones all your life. And now you suddenly, your body become depleted of it. So the most natural thing is to give back what's missing. Similar how you would do if you have a diabetes and your pancreas stop making insulin, to give back insulin.
But one thing I'll ask is, is this controversial in terms of, does it increase the risk of breast cancer or ovarian cancer? What's the
So
science
all
and
that
data on that?
controversy started after a WHI study where it was a poorly done study. Women were getting synthetic oral estrogen that we don't really give anymore, and they didn't really collect the data properly, but they start getting these reports that, oh, women develop breast cancer, somebody's died from stroke. So they came out before even going back and reviewing the data and said estrogen kills women. So millions of women were taking off the hormone replacement therapy overnight. And if you evaluate the data from like 2001 till now, there was significant increase in mortality because women didn't have that hormone replacement.
So it's actually beneficial in terms of not only helping the symptoms,
it's protecting the
and
heart,
protection.
the blood vessels.
Wow, I didn't know that.
It's protecting the women from osteoporosis. It helps with mental acuity. There is so many things it's helpful for. So replacing the estrogen in a physiologic doses is actually the best thing that you can do.
Do you prescribe all your patients hormone replacement, or
Well,
most of them, or?
I have a conversation with them, and it's definitely my recommendation. And like it's very natural, and I think because people have this like stigma also around the hormones, the moment you say estrogen, they think it's death, but it's actually not, or cancer, which is not true. So now we're replacing the hormones through the skin transdermally, which doesn't go through the liver, so it doesn't increase the risk of blood clots, yeah, patch or cream, and also replace like giving progesterone for women who have a uterus to protect the uterus, and also testosterone. We start losing testosterone now in 30s, and it doesn't feel good when you don't have testosterone on board. It's a low energy, so we're also replacing that. It's considered to be off-label just because
the testosterone part.
Right, testosterone part. You can order on-label testosterone from Australia without medical license. You can do that. There used to be a testosterone patch in Europe, but because it was produced for sale, they took it off the market. So now we either do male testosterone, we're just redosing it, or go for compounding.
Which is, the male testosterone obviously is available.
Yes, it's available. You just need to use like a smaller dose. And women feel significantly better. And it's just very upsetting because by the time we reach our perimenopause, menopause age, we already had kids, we have our career, we're successful, we're ready to enjoy life, and then menopause hits. And it's horrible. So I feel very fortunate that I can provide that to my patients so they can go ahead and enjoy their life.
So I have an electric car now, but once in a while I'll go to a gas station to get a drink or something. And you always see these weird sexual supplements. What are these? Are any of these scientifically proven? What are they? What's in those?
Who knows? Yeah, I know the ones that you're talking about. I'm always very curious, and I always offer my husband to try, and he refuses. Um, I would say the safest thing is to stick with your urologist, as if you're a man, who can prescribe you the supplements if you need it. There is actually some medications that are approved for women, FDA approved for women. There is a condition called hyperactive sexual desire disorder. What it means in English, some women, no matter what they do, how healthy they are, what medical condition they have, and no matter how great their relationship are, they still don't have libido. So there's two medications, one injectable, one a pill that women can take to help improve their libido. And in some cases, for women who never able to experience orgasm, I prescribe those medications as well. They consider to be out of label, but they can help as well.
Interesting. This is kind of the female version of Viagra or Cialis, essentially.
It works differently.
It's
You can
obviously
still
different.
you still can give Viagra to women to help with
That's
like
interesting.
clitoral engorgement. We have exactly the same anatomy in the clitoris as a man and a penis, so it could help for different reasons. But for, like, let's say libido, you can have the medication actually officially prescribed, and you can take it.
Very interesting. Viagra for women. That is something I did not know.
Yeah, you might have heard about little pink pill. That's a referral to the medication flubanserin that you take daily. And the amazing thing about that medication that other than improve sexual drive, it can actually improve your sleep, help to lose weight, and improves mood.
Let's talk more about sex. Is morning sex better? What positions are more desirable for women? Is it personal preference? Is there any science behind any of this?
Great question. Well, it's better to have sex during the daytime because during the nighttime, it's not as beneficial. There's not as many like hormones produced. So it's better to have sex in the morning.
Okay. So
And
wake up in the
also,
morning
and also not like after you have like a big dinner and you're tired after work. Like, no, it's like the worst settings possible. So I kind of teach them like what to do and what positions to be in to not make the condition worse. For example, if you have a uterine prolapse or bladder prolapse, any upright position will not do you any good because you work against the gravity. So, but anything laying on the back with the propped hips can help. In terms of some people have incontinence when they have sex, and it could be due to the overactive bladder when medication can help. And in some cases, have sex in the shower can help.
So in the morning, in the shower, is what you're saying.
Basically.
So this is very interesting. There's so much science and data behind this that it's not really talked about, and it's good. It's good for women to know, especially my listeners. I have a lot of women following. It's important to know that there is someone like yourself who is an expert in this. If they're having any issues, you could discuss it: pelvic prolapse, pain while having sex, just on and on of sexual health. So it's not very common. I haven't seen a lot of sexual health professionals here, at least in Beverly Hills.
I think you do have some professionals who do like some injections, like a lot of like kind of unknown procedures. But I think it's very important to like it's very important to learn who you're talking about as a patient, what's they offering, and if they evaluating you from like 360 degree to make sure that you're getting a better, like a good care.
I'm looking through TikTok. I always come on to little reels that say, if you want to have a boy, use this position. If you want to have a girl, this position. Is there any science or data behind that?
I don't think the sperm cares what position people are, but what's important is because the sex depends on the sperm, so it's important what guy does in a like 70 days preceding the sexual activity, because if they staying in like doing hot tubs in a hot environment, wearing very warm clothes, that will make males, like the sperm that carries male karyotype, a little bit less active. So more likely the sperm that carries female karyotype will survive. So you're more likely to have a girl.
That's interesting.
So if you want to have a boy, try to not do like a hot shower, do like go swim in the ocean.
So hot
That
showers for the week before, leading up to
so
ovulation.
the sperm actually renews every 69 days.
69 days.
Yes, isn't it funny that
How
it's
do they
69?
choose that? How do they choose that number? So every 69 days. So the
Yes.
sperm you make is there for 69
Yes.
days.
Yeah.
So in the last 7 days prior to having intercourse, if you're planning to have kids, is use the hot tub, do some hot yoga.
There is no actual like scientific. It's not actually scientifically proven, but there is a belief that if you're going to have exposure to the warm environment, like a hot tubs, you're more likely to have a girl. And if you're going to have more exposure to the cold environment, you would have a boy. The sperm that carries male karyotype tend to be faster. So if you have sex right at the ovulation, you more likely to have the boy. And if basically sperm needs to sit around and wait for women to ovulate, it's more likely the the sperm that carrying female karyotype to survive.
So the male sperm kind of does its thing, goes fast, and just dies.
Yeah, fast and furious.
Fast and furious. So that's interesting. If you want a girl, a week before, start using the hot tub. Hang out in the hot tub.
Again,
hot
it's
yoga.
not the exact prescription.
Well, it's people always ask that question. I have patients who have 5 boys one after another, and they want a girl. So this is very interesting.
But again, there's like a lot of questions like that, and I think if somebody really want to have a girl or really want to have a boy, they should go to their reproductive endocrinologist, and they have a ways to actually sort the sperm and make the male embryo, female embryo, or screen them.
And that's going through IVF. That comes with this
That's probably going to be your next guest.
So reproductive endocrinologist.
Exactly.
So, but that's a whole process. You're going to have to inject yourself with hormones. They're going to have to harvest the egg and the ovary, and then they have to separate the embryos into male and female embryos. That's a whole process.
Well, some people, they can be very desperate. If you have like 5 girls and you really wanted that boy, sometimes
That's what people do.
Yeah.
How much does this cost?
Again, that's going to be your next guest to tell you how much.
So speaking about TikTok, do you have any myths or facts you want to debunk that you've seen on TikTok?
Yes, there is sometimes crazy things comes up.
Lots of crazy things.
Women putting a garlic inside of the vagina to prevent from yeast infection, which is straight dangerous because garlic can cause skin burn. So I wouldn't recommend that.
No garlic. Let's keep the garlic in the kitchen.
Exactly.
Out of the bedroom.
Exactly. Some people put potato in the vagina in order to help with prolapse symptoms, which is, come on, we're in 2025. There are pessaries, there are surgeries. So keep potato in the kitchen too.
Potatoes in the kitchen, okay. So garlic and potatoes in the kitchen.
There is this over-obsession with probiotics, that you should be taking probiotics 3 times a day, all the time, to help with your vaginal health. And it's not true. Everything is good in moderation. And I do see increased numbers of women who has cytolytic vaginosis, which is a completely different topic, but probiotics can play a role in developing this condition. Always drinking fluid all the time. People feel like they're not drinking enough. It's actually not true. I mean, it's kind of love and hate relationship with that topic, because when people drink a lot, they pee a lot and they come and see me, which is I'm very grateful for. But it's not really necessary to drink that much. And I think this over obsession is
hydration.
Too much.
Hydration is good, but in moderation.
Exactly.
How about cranberry juice?
And
UTIs.
So cranberry is really good to prevent urinary tract infection, but it's not the cranberry itself, it's the active ingredient, PAC. And you do need to have a certain amount of PAC per day in order to prevent urinary tract infection. So if there is not amount of cranberry juice you can drink to satisfy that requirements, and also there is no way you can know how much PAC in your juice. And also, juice can irritate your bladder and can have a sugar. So if you're trying to prevent urinary tract infection, it's better to have a cranberry supplement, not a juice. And also, don't try to have a vodka cranberry cocktail. It doesn't work as well, too.
Now that you brought up alcohol, how does alcohol affect female libido?
It's a very interesting question. So it can relax in some sort of way, kind of provide that disinhibition for people who feel like very tense or not very confident in themselves. But the pleasure might not be as good because everything kind of like muted. And I mean, sex is a beautiful thing. You don't really need to get drunk to enjoy it. Have a glass of wine, totally fine. But it's not the best. It's not the Viagra for women, for sure.
So a lot of my listeners are younger women in their late teens and 20s and 30s. Is there anything you want to share with them about sexual health or anything related to that?
Absolutely. You know, I would like women to know that if you're taking any hormonal contraception, it can affect your sexual drive and it can affect your vaginal skin, vaginal dryness. And the reason, and for some reason, nobody talks about it, but the reason for that is when we take, for example, oral contraception pills, it increasing the amount of the sex hormone binding protein, special protein that our liver produce, that when we have a lot of it, it binds to our hormones. So we can have tons of hormones, but they're all inactive. And when it happens, there is not enough hormones for the vaginal tissue, for the bladder. So a lot of young women who I see start experiencing urinary urgency. Sex start hurting. They feel uncomfortable and dry. This, like, orgasm doesn't feel the same.
So it's not just for older ladies; it can also be younger
Exactly.
ladies.
So they develop the same syndrome as women who go through menopause have. We call it genitourinary syndrome of menopause, which means symptoms of dryness from the vaginal canal, urinary symptoms. So young women can experience that as well. And if they've been taking oral contraception pills for like 10, 20 years, they, like, if you look at the genital area, because I look at a lot of genital areas due to my job, like, you can see how it can be more atrophic, different, smaller clitoris. So there is way to fix it. Either stop hormonal contraception pills or use estrogen and testosterone cream topically to help with the symptoms. But it's something that definitely to be aware of. Because a lot of people who I see, they think that something majorly wrong going on, like they have a cancer or like MS, but actually the contraception can cause those issues.
We talked about a lot today. This was very educational, informative for, again, I have a lot of women patients. I would say, 75% of my practice. And this was really educational for them to see and kind of talk about these topics that they may be afraid to ask, or maybe they don't know where to look or get information from. So I really enjoyed talking about these topics. Again, interesting having
friends.
Yeah, our friends. We're thanking our friends for joining us today. But thank you for coming. We hope to see you around. And again, we share patients all the time in terms of, again, the functional and cosmetic aspect of it. If you want to follow Dr. Dubinskaya, how can we find you on socials?
Dr. Urogyne.
Dr. Urogyne on TikTok, on Instagram,
YouTube.
And YouTube.
Yes.
We'll leave the links below. Follow her. She has a wealth of information. Thank you again for coming.
Thank you for having me.
This was another episode of Secrets of the Scalpel, Beverly Hills Plastic Surgery Exposed. I am your host, Dr. Ariel Ourian. This podcast is meant to be for you. If there's a topic that you want to hear about, if there's a professional that you want to hear from, let us know. Send us a DM and we will absolutely have those guests on our future podcasts. Thank you for joining. We will see you next time.